Hey, good evening, everybody. My name is Dr. Nathan Thompson with Exemplify Health Center, an affiliate of the Wellness Way right here in Yorkville, Illinois. Happy Monday evening, guys. Hope you guys are doing great. I know that we're seeing some people popping on right now. And if you are joining us as we stream from Facebook at Dr. Nathan Thompson, Facebook at Exemplify Health Center, and then also on YouTube, make sure you say hello and make sure you let me know where you're watching from. I always love seeing where people are watching from as well, and also saying hello. Thank you guys so much for the engagement. I'm always honored. I'm humbled when you guys watch, when you guys listen, just to give you guys a little bit of different perspective when it comes to health. And listen, the reason why we give a different perspective is because if the perspective isn't working out, if it's not getting you better, then doing the same thing over and over is not going to give you a different result. You need to start looking at things from a different perspective. And so many times people will argue, coming say, that is wrong based on my perspective. Well, understand this. If you came to a house that was on fire and the fire department put it out, you come back the next day, fire department comes and looks at the house that they had just saved the house and put out the fire. And then you have a carpenter who comes and they're both staring at the same picture. The fire department is going to say, I did a great job. The carpenter is going to say, we have a big mess here. And because they're coming from a different perspective. One says we try to save the house, we did good. The carpenter says we have a lot of work to do still in order to try to rebuild this house. They're both correct. They're both correct. And it's just a matter of perspective. And that's why when we look at healthcare really is just about fire department thinking. It's there to save your life. It's there to stabilize you. The only problem is they think when the fire comes out, they put the fire out, that somehow sprinkling the house with water every single day is going to prevent a fire from coming back. But remember, if you never rebuild the house, all that happens is you just live in a sick house. And so we're the carpenters. We are the crime scene investigators saying, what caused this fire? And not only that, what do we need to do in order to rebuild the house so that you can actually live in the house, but also figure out why did this happen so that you don't continue to have more fires down the road. Okay. So we're going to talk about allergies, and I need to cycle through actually a little bit and go, because last week we went over part one. We went over the myths when it comes to allergies. We saw how that is actually exploding in the United States over the last 40 to 50 years, not only here, but also in Canada. We know that the National Institute of Environmental Health Sciences says autoimmunity is a big concern because we're seeing it absolutely explode. We went over Mayo Clinic and what they describe as allergies. And then we looked at, here is how medicine approaches allergies, which is just different kinds of things in order to block an immune response at different parts, either actually coming from the immune cell, coming from the what is receiving the chemical response, or allergy therapy or things like that, trying to get you more used to the specific allergen, or actually just blocking out the whole immune response. And that would be things like corticosteroids and things like that. So again, the biggest thing that we left on was, does any of that actually address the cause as far as why allergies, why asthma, autoimmunity, anything that is involving a hyperimmune system response, why has that been getting worse over the last 50 years? And I'm going to give you my perspective. And it probably will offend some of you, okay? And I'm not, just so you know, I'm not trying to offend you, but also if something needs to be said, we will actually say it, okay? Because if your child does have allergies, and you're also speaking to someone who grew up with terrible allergies, terrible asthma. I have not taken an allergy medication. I haven't taken an asthma medication in over 20 years. So as someone who had developed allergies, but also has overcome them as well. So we're going to talk about today the immune system, and we're also going to talk about solutions. And I'm actually going to talk about physiology and come from a perspective of physiology and how we're going against physiology. And that can be the reason why so many people, more people are developing this response. Yeah, we'll talk about food allergies, what are known as IgE, which most people can identify. We'll also talk about IgG food allergies. We'll talk a lot about stomach acid. We'll talk about secretory IgA. We'll talk about antibodies. We will talk about stomach acid, a lot of different things on why it is getting worse and why there is no solution as far as why it's getting worse, other than more and more drugs, more and more medications, and finally actually just trying to develop better drugs. You ever wonder that? You ever wonder that? How rather than try to figure out why it's happening, that pharmaceutical industry is just trying to develop better and better drugs. And that's a lot of when I use some of this research, that their answer is we should try to find the cause of why this is happening. It's no, this is because this is happening this way. Then we need to be investigating and investing in better and better drug options. But I will go back and say, why don't we just get to the reason why it's happening in the first place? So again, guys, if you're joining us, make sure that you actually say hello. Let me know where you're watching from as well. And while we see people that are still joining us, make sure, guys, that you follow us on YouTube and Rumble. If you want to see the replay of this videos, they're all uploaded on there. And a lot of times, guys, if people say, do you have a video on that? Go back to there first, and you might be able to see that we do already have made a video on it, because there are years and years of videos that we've been doing this. However, if you want to share this video too, sometimes it's easier just to share the Rumble link and share the YouTube link, because that will be uploaded there within the next couple of days. And if you want to see maybe a little bit of glimpse into my life, a little bit more personal life, you can go on Instagram, also on TikTok as well. We will tape a lot of short videos that sometimes get misconstrued, because how much can you really talk about in 90 seconds as well? Here's what's interesting about Instagram is people ask me, they're like, hey, I follow your workouts. Can you post your workouts? I'm like, yeah, sure. It's not really a big deal. So I usually on stories, I will post my what I did for a workout that day. I know necessarily that I would rather have guys follow that workout, only because women are a little bit different as far as when they should be working out as well, depending on their cycle and things like that. But today I posted a video of what I did for a workout, and it took about 45 minutes total time, but literally probably only about 15 minutes of total work that I did. So make sure you guys follow us on there. And if you don't, that's okay too. I don't do this for followers necessarily. And guys, our next inflammation talk is going to be coming up on Thursday, May 18th at 6 o'clock. Guys, this is also an in-person event. I think we had 10 people who registered from Europe, which, guys, I'm honored that you would want to hear me speak. But this is an in-person event. About 95% of our patients that we see are in person, only because it's easier to do it that way. But we are going to talk about inflammation, which is the first thing that you have to overcome. And you have to understand what inflammation is, where it comes from, that it's an immune response, but also what can cause inflammation. I'm even going to talk a little bit about it today, as well as once you understand your barriers, where most of your immune system sits, that'll give you a good clue as far as what you need to be doing when it comes to inflammation. But yes, it is tied to weight loss, resistance to cancer, infertility, thyroid disease, arthritis, type 2 diabetes, autoimmune conditions, hormone imbalance. And I know a lot of people are talking about inflammation, that it's good or that it's terrible. A lot of health, natural health, influencers talk about inflammation a lot and saying, yeah, just take curcumin and some ginger, some turmeric. And I'm like, it's deeper than that. Okay. It's deeper than just taking anti-inflammatories. Because again, a lot of people are looking for, well, I don't want to take the medication. You have something natural. I'm like, that's not the point. The point is not to need even things that are natural as well. So we talk about it from a lot deeper level. So if you are from the Chicagoland area, all you have to do is just go to the top of our page, go to Linktree. If you're on Instagram, you can go to the top of the page. If you're on Exemplify Health Center on Facebook or Dr. Nathan Thompson on Facebook, go to Linktree and go to the link that we have provided. You can register directly for the inflammation talk, the in-person event on Thursday, May 18th, 6 o'clock sharp p.m. Central Standard Time. And we will talk about inflammation. And also at that event, we also have a gift for you as well. So really, really excited. All right. Allergies part 2. Let's talk about your immune systems, guys. And I always love using actually medical research when we talk about this, because this is actually a wonderful article from Gastroenterology about 8 years ago. And they talked about the physiology of food allergies. Now, this can also be tied to other allergy type reactions. So I know that when I'm looking on Instagram, I see a lot of people that have asked about MCAS, things like that, mast cell activation syndrome. Well, this also has the same response, because in order for mast cells to degranulate, there has to be an IgE antibody. So food allergies, they talk about, called food allergies, the basics. And I highlighted some of the things that I want to talk about with this. So here's what they say. So number one, the prevalence and severity of food allergies seems to be increasing. I agree. They'll say, well, in addition to genetic factors, I disagree because you wouldn't see allergies go up that much over the last 40 to 50 years. Our genetics haven't changed that much, but they do say there's a number of environmental, cultural, and behavioral factors that affect the frequency, the severity, and the type of allergic manifestations in patients. So I love when they say, well, there's just something with genetics and there's probably something environmental as well, but we really don't know what it is. And I'm always like, well, why aren't you trying to figure out, what the environmental factors are? That is absolutely huge. But a lot of times when they don't figure out the reason why, they'll say, we don't know why environment affects allergies, for example. But they'll say, we definitely know it's not this, this, and this. And I'm like, if you don't know what it is, then how can you so confidently say that it's definitely not X, Y, and Z? But they'll always say that. Here's what they say. A recent study identified epigenetic differences, epigenetic, which means not genetic, it's your genes changing according to your environment, in CD4 T cells from children with IgE-mediated food allergies compared with children without food allergies. The first clue that they're telling you is that there are changes in certain types of immune cells, CD4 lymphocytes, also known as helper T cells, T regulator cells, mostly helper T cells, and that help to balance between having an immune response too much or immune response too little. So they see a change and a difference in kids with food allergies and also without. Now, here's what they also say. We're seeing changes in their immune system. And then according to also other things that we're looking at, the hygiene hypothesis. I'm going to have a field day with this one. The hygiene hypothesis, meaning maybe we're too clean, that we're not getting any exposure to anything. Now, let me pause there and say this, because didn't we already see this as living proof? Because one of the things I got a lot of questions on about a year ago is, over the last 3 years, a little over 3 years, the young kids weren't exposed to anything because they were at home and they were, quote unquote, socially distancing, and they didn't have an opportunity to exchange the bacteria and the viruses with other kids. And as soon as that when all of this lifted and they took them to daycare, it was like this mass of all this different kinds of infections that were taking place all at once, and people were just absolutely befuddled. Well, if they didn't have an opportunity to get exposed to specific antigens, then they got exposed to all those antigens all at once. And that was the reason why you saw so much illness right when you got your children exposed for the very first time. Heck, even parents and normal people were seeing an increase in exposure as well, because we need constant exposure of other people's germs in order to help produce an antibody response the right way. And I'm going to go over what the right way is and what the wrong way is. So they talk about the hygiene hypothesis, the things that we're trying to keep our kids too clean, that we're literally trying to sterilize, keep them in a sterile environment. And you don't have to look too far. Go to the grocery store and you see that they have hand sanitizer literally everywhere. And we have, mothers and fathers that are slathering their children in hand sanitizer, literally giving them anxiety because they're super scared that some kind of germ is going to, quote unquote, attack them. But then you also look at decreases in family size, and improvements in personal hygiene have contributed to the increased prevalence of IgE-mediated allergies. Not necessarily true. I'll actually show you why. On the other hand, factors such as anthroposophic lifestyle. This is what's really interesting, guys. Pay attention to this. The anthroposophic lifestyle, which is eating organic foods that contain lactobacillus, and restrictive use. Now listen to this. Restrictive use of antibiotics, antipyretics, and vaccines have been associated with a reduced incidence of allergies. That's really interesting, right? The research is showing, hey, you know what? Don't give your kids antibiotics all the time. Don't give them fever reducers. Let their immune system be able to develop. And also, they do breach that topic of vaccines. Interesting, right? Now, I will tell you this. I have 4 kids. Our youngest is only 2.5 months old, but we have a 16, a 14, and a 12-year-old. What's really interesting is that we have, they've never been on antibiotics, never been on any kind of fever reducer, haven't been on any kind of drugs. And also the other one is also true. And my kids have 0 allergies whatsoever. zero allergies, zero asthma, but I suffered horrendously when it comes to that. Now, you may make the argument, well, they're dangerous, germ infested children. I would beg to differ that as well. And just look, is have the experience. And the only reason why I haven't done that, guys, is because I'll show you it didn't make sense. It didn't make sense. So have been associated with a reduced risk of allergies. So they're giving you the clues. So write down those clues about being too sterile, high amount of antibiotics, fever reducers, and also the other one. If I say it too much, I'll get banned. All right. So they continue to say this. How do food allergies, and we're going to talk about IgE food allergies just for right now, but we'll talk about some other ones too, is how do they start? How do they start? So here's what they say. Upon interaction with food antigens, so with a protein that's coming from a food, IgE. Now, in order for that to happen, guys, a food protein has to cross your barrier. Okay. So it's got to cross the barrier some way. And so you have barriers in your body, in your skin, genital urinary barrier, lung barrier, and also in your intestines. Okay. So there has to be an unbroken down food protein that has to cross the barrier. So I want you to think about how do we get this to cross the barrier? Well, if you're eating it, the first thing that has to happen is you don't break down the proteins enough, and that's a function of stomach acid. But you can also get another way by bypassing your skin barrier, if you know what I'm talking about. So the antigen IgE becomes cross-linked. Okay, so this antibody becomes cross-linked and binds to mast cells and basophils, which are considered granulocytes. And what happens is they release granules that then contain preformed inflammatory mediators. For example, histamine. Now, there's other things as well. So leukotrienes, which you'll see how they block some of that in some kind of allergy medication, different proteases like tryptase. I think that's one of the things that you can do to see if you do, in fact, have mast cell activation syndrome is look at these proteases, your level of tryptase. And within a few minutes, IgE cross-linking, therefore, the process is called an immediate allergic reaction. Symptoms occur shortly after allergic contact. So this is an immediate response hypersensitivity type allergy. Okay. Now, someone has said, yes, but mast cell activation syndrome, it's way more complex because there's so many of these inflammatory things that are going on. They all start with degranulation of the immune cell. Everything else has to start with that. Everything else is just a cascade in order for that inflammatory process to take place. Now, here's what they continue to say. Because food allergens enter the blood via the gastrointestinal tract, not always. Symptoms can develop directly at the site of allergen contact, like at the mouth, like at the esophagus, or in the intestines and in other organs. Systemic reactions occur when the allergens capable of cross-linking effector cell-bound IgE pass the barrier of the mucosa into circulation. So it has to pass the barrier in order for that to become an allergen, to have an IgE type response. Allergen uptake also may affect the circulatory and the nervous systems. That's why you do see circulatory changes that take place, like when you see like hives or you see flushing, things like that. But you also, what's interesting is they do admit that you will see nervous system changes. And I have said this before, is that if you have an individual, you have a son or you have a daughter, and they're having neurological symptoms that are going on, i.e., ADHD, ADD, depression, bipolar. Guys, you have to consider that there is an immune system component to it because of how the body responds to these inflammatory chemicals. And the fact that we just say, I guess there's nothing that you can do, I guess it's all a brain type of thing. Remember this, I will always say the brain is the antenna, and what is happening in the body, the brain is actually the receiver for it. And that's why when you are talking about these things, you cannot neglect the immune system in this equation, but it is neglected in this equation. Now, here's what they say, where they say factors that contribute to the type and severity of these reactions and the amount ingestion of allergen. So here's the factors. I misspoke. The factors that contribute to the type and severity of this IgE reaction is this: how much of the ingested allergen you consume. Now, here's what's really important: the stability of the allergen against digestion or breaking it down within the stomach, and then also the permeability of the epithelial barrier, whether that's the skin or whether that's the digestive system. Now, guys, ever heard of things like leaky gut when they say it doesn't exist? Well, they are saying that people do have a more permeable gastrointestinal system that will allow for more proteins to leak through, therefore causing an immune system response. Now, what are the factors that they say in this article from PubMed that says what are the factors that will determine whether how permeable your gastrointestinal system is? Here's what they say: factors: alcohol, anti-inflammatory drugs like antipyretics, for example, certain pathogens like E. coli, for example, or stress. Yes, and there can be other things like gluten and the subprotein known as gliadin, which is why I am a huge fan of being grain-free. So, all of these things, even stress, have been proposed to reduce the barrier function of the intestinal lining and facilitate that sensitization. Now, on the other hand, secretory antibodies, particularly secretory IgA, have important roles in reinforcing the epithelial barrier. Remember secretory IgA and how the body protects against antigens, specifically when you're talking about anything like that contains a mucous membrane, including your gastrointestinal system. What's really interesting, and I'll go over this in just a second, is that babies cannot make secretory IgA in the first formative parts of their life, in which they need that secretory IgA, and it's passed from mother's milk to the infant. Now we're going to talk about other things that can happen, especially when they said it's not a big deal if you just give your baby formula. Okay. Now, preventing food allergies, here's what they say. According to the current food allergy and anaphylaxis guideline of the European Academy of Allergy and Clinical Immunology, here's what they say. Exclusive breastfeeding is recommended for the first 4 to 6 months of life, which can prevent the development of allergies. Exclusive breastfeeding the first 4 to 6 months of life. Guys, one of the reasons why, and I would say even extended out to 9 to 12 months as well, is because babies are born with a hyperpermeable gastrointestinal system. Okay. That's why when they say, oh, you can go ahead and start giving grains at 4, 5, 6 months or whatever the old recommendation or the new recommendation is that is still too soon. So, and if you can't breastfeed, here's what they say. Well, if you can't breastfeed, then we need to actually be having things that don't have these things that are going to cross the gastrointestinal barrier and then cause an immune response. Because, guys, have you ever seen in the unfortunate circumstance where mother was having a hard time breastfeeding and they went to a formula, and when they went to a formula, the baby was very colicky. They were arching their back. They had tons of belly bloating, and that was having an immune system response taking place within the gastrointestinal system. So the reason why breastfeeding, guys, is so important is breastfeeding transfers protective secretory IgA to the child, which may prevent allergic sensitization and avoid early exposure to potential food allergens. Very interesting, right? This is why breast is always going to be best. Don't let anyone tell you otherwise. But I remember the push to say, yeah, you don't need to breastfeed. And we are learning that more and more and more. And guys, I will always say this is if you always go according to design, then you're going to be doing pretty good. It just seems that man thinks that they know more and that they're smarter. And there's a lot of examples that I could give. Hormonal birth control is another one in which they think they're smarter than the body. And you have seen the devastating consequences as a result. So they'll give you clues as far as how to prevent food allergies, but I'll actually kind of corral all of them together and give you a list if you guys are willing to just hang on with me to the end, especially. Okay. So here's an interesting thing, because this will give you another clue. This was an article that came from 2007 from the Australian Science Fund. And the title of this was known as High Levels of Antibodies, Low Levels of Cancer. Okay. And here's a summary. Active immunization can stimulate the body to produce highly efficient IgE antibodies that attack tumors. The breakthrough achieved in animal models based on the skillful combination of two established experimental methods. So you might say, Dr. Nate, what on earth are you going with this? And I want to show you this because there's a couple of really interesting clues. So here's what to say. Active immunization can stimulate the body to produce highly efficient IgE antibodies that attack tumors. This was done in an animal model. They used rats for this. The antibodies produced during the project belong to a class that also plays a key role in the development of allergic reactions. Now you might be saying, "Oh, hallelujah, I have terrible allergies. That means I'm protected against cancer." You're not protected against that cancer because basically what they did is they basically fed the mice a protein that was similar to that was present in the tumor. Okay, so here's what they did. So in order to feed that tumor, they knew how to elicit an IgE antibody response when they fed them that protein. What they had to do was they had to inhibit stomach acid production in the rats so that it would pass through the stomach, that the stomach acid wouldn't break down the protein, and that protein would then make its way into the intestinal lining, would then leak through, and then would cause an IgE response. So the immune system had to see that whole protein intact. This is what's absolutely amazing, because here's what they said. Professor Jensen Jurlin's team therefore fed mice a peptide very similar to a tumor peptide while reducing acidification in the stomach, thereby hindering digestion or breakdown of that protein. And as a result, a type of allergic reaction was triggered against the tumor-like peptide. So what did they do? Now you should be looking at maybe there is a reason why we need stomach acid. And I have had people, when they don't understand the purpose of stomach acid, number one, it's first and foremost to sterilize your food. And number two, is there to break down your proteins. And incomplete protein breakdown wreaks havoc on the gastrointestinal system. And so they needed to stop gastric acid production in order to elicit an allergy response. So if they can elicit an allergy response to a tumor peptide, maybe also not having enough stomach acid can also elicit a allergic response to whatever food protein that you might be eating. So they go on to say this, hey, can you have adverse reactions to food? Well, here's the different types that you can have. You can have a toxic reaction to food that doesn't involve the immune system. So this can be enzymatic, like a lactose intolerance, meaning I lack the enzymes to be able to break it down. And so these whole foods actually make their way down the gastrointestinal system. The body sees this and says, send it back, send it away. This is not good for us. Guys, when I see this because this can happen in people who don't have good pancreatic enzyme function. And yes, you can get a fatty liver. You can also get a fatty pancreas. And if you don't have good pancreatic function and you're not releasing enough of the enzymes in order to be able to break down your sugars, be able to break down your fats, for example, you'll have large bands of fats, large chains of carbohydrates make their way down that the body just wants to get rid of, including you can also have a similar response when you don't have a gallbladder and you have a bunch of fat, which is what is known as dumping syndrome. So you can also have adverse reactions to medications as well, okay? So you can have that would cause an adverse reaction. Some of you may have actually taken a medication and you had an IgE allergy response, and that's the type of response that you had. Now, when you talk about what they would call a non-toxic one, they say, well, there's a type 1, there's a type 2 and type 3, and there's also a type 4 that's immune mediated. Now, the ones that they talk about are only type 1, which involves your IgE and T cell associated food allergy. That's the only thing that they consider a food allergy. You can also have a type 4 allergy that's usually involved with celiac disease. But also what's interesting, they talk about type 2 and they talk about type 3. They just have a question mark there, meaning like, well, we know it happens, but we really just don't understand it. So here's what's interesting. A type 3 allergy response to food is an IgG delayed, what you would call allergy or hypersensitivity response. and nobody actually talks about it. So yes, it does in fact exist. It's just that it doesn't have the classic allergy signs of sneezing, running nose, or anaphylaxis or things like that. So why do they only measure, or they only mention IgE reactions? Because they don't really understand what an IgG response would be. Now, here's an example of a person. I just tested him and went over his results not that long ago. But here's someone who had in the past, they have had cancer at a very young age. They got their gallbladder out in their mid 30s, and they were experiencing now tremendous amount of systemic joint pain and also a lot of fatigue that's taking place. So we measured IgEs. We also measured IgG food allergy. He didn't have any IgE food allergy, but he had 34 different IgG food allergies. And I know what some people are going to try to say. So I already created a slide in order to prevent that from happening. But what this means is this is meaning these proteins aren't broken down properly in the stomach. Those whole food proteins make their way down into the small intestines. And then there has to be something that makes that gastrointestinal barrier more permeable to be able to leak through. And now there's an IgG response to it. Immune system sees that food protein, even if it's coming from something that's healthy like kale, says you don't belong here and we need to get rid of you. Remember, what's the job of the immune system? It's the job of the immune system is to respond to proteins that don't belong in your body. And that can be a bacteria, that can be a virus, that can be a toxin, and yes, that can also be a food as well. So a lot of times, the rub when you are doing an IgG food allergy, and guys, just so you know, there are really bad IgG food allergy tests. There's also really good ones. The really bad ones, there are 4 subclasses of IgG food allergies. A lot of them only test just one of them. The one that we use, all 4 subclasses have to be positive, which then makes it a true allergy type response. Because a lot of people say, well, that's just showing exposure. It's showing exposure. And I say, well, you're exactly right. It is just showing exposure. But guess what? Food proteins don't belong in the body. Food proteins, again, do not belong in the body. What belongs in the body are amino acids, which are proteins that have been broken down, and where they're broken down within the stomach. Now, if you look at how we live today, we eat on the run. We're stressed out more than ever before. Eating is actually an afterthought and not necessarily an event. And there's a lot of different reasons why people suffer so much with low stomach acid production. And in fact, if you look at the number of people who got reflux that are saying it's because they have low stomach acid, I'm like, nope, not because you have low stomach acid or you have too much stomach acid. Remember, in order for you to produce stomach acid, you need to be in rest and digest. So it's almost like saying I'm too relaxed. I got too relaxed, so I made too much stomach acid. So no one's too relaxed, but people are stressed out. And when you're stressed out, it inhibits the production of stomach acid. So you have too low a stomach acid. And when that happens, you're not breaking down your proteins the way that you need to, which is a good way in order to develop both IgG and IgE food allergies. So the question, it begs the question when we talk about this, because we're starting to leave you clues saying, hey, maybe there's something that has to do with stomach acid production. Maybe it has to do something with being breastfed. Maybe it has to do something with introduction of foods too soon in infants. Maybe it has something to do with introducing proteins by bypassing the normal stomach and skin barrier. Maybe it has to do with things like that, but I'll show you a couple other things as well. And guys, once you understand where most of your immune system is located, then a lot of things that you will see that when they do this in medicine, they're not going to make a lot of sense to you. Because where is your immune system located? And I'll see if anybody says this or says the right answer. Where is most of your immune system located? And a lot of times people will say, if you're just guessing, well, I guess it's in the blood. Nope, it's not circulating in the blood. The next question, when I say, where is most of your immune system located? People will say, it's in the gut. And I say, why? And then they're like, because that's just what I read. So why is a lot of your immune system in your gut? And they're like, I don't know. Actually, where is most of your immune system located? where your immune system is located is actually here at your barriers. One of them happens to be the gut, but it's also your skin, it's also your lungs, it's also your genitourinary barrier. So the gut is not special. A lot of your immune system sits there because it comes into contact with the external environment of the body. Yes, when you eat food, that food that's going down the digestive system is still considered the exterior part of your body. So is deep into the lungs, so is your genitourinary barrier, and so is between skin and from the outside and the inside. So where does most of your immune system sit? Anytime the body comes in contact with the external and internal environment. So it's not necessarily just in the gut. I would actually say you probably have more immune cells sitting underneath the skin. So the body wants to fight the battle at the barrier, and it doesn't want to wait until it becomes systemic, circulating through the blood. So if you look at what a normal immune system reaction has to be, in order for you to have a normal immune system reaction, then you have to have exposure at the barrier. So you come in contact with any kind of toxin, bacteria, virus, or a food. And what happens is you have exposure at the barrier, and you will have what are known as antigen presenting cells that will actually either take in the virus and present it, or you have certain things like dendritic cells that will then take like a food protein and then present it. And it presents that specific, whatever that antigen is, and it presents it to a T helper cell, which then coordinates this immune system response. Natural killer cells, cytotoxic T cells. These are responsible for tumor suppression. These are responsible for viral cells that are infected virally as well. And then you also have then the production of antibodies from your B cells. And then you also have this play of T regulator cells, which then help to coordinate this immune system response as being not too much, but then also enough, guys. And the reason why I circled these T regulator cells is because once you lose control of this, then a lot of times you'll see people with hyperallergic responses, a lot of food allergies, and also autoimmunity as well. And there are certain things that help to regulate these T regulator cells. So this is how you fight off any kind of foreign protein. But you'll notice that a lot of things that we do actually are doing things that abnormally bypasses those barriers. So we have to start looking at, okay, well, we always talk about antibodies, antibodies, antibodies. Well, what is an antibody? What is it? So we think that that antibody production equals immunity, and it doesn't. Antibodies, all they are is this, is that these are chains of protein. They're made by your B lymphocytes, and they're made in response to a foreign protein. This could be a sliver, for crying out loud. So it can be to a virus, it can be to a bacteria, it can be to a food, it can be to a toxin as well. And I know a lot of people had asked about Botox. Yes, you can make antibodies to Botox, which means, guys, the longer you are getting injected with Botox, the less likely it is to actually work. And how these antibodies work is they work to tag a protein to do a couple of things. If you have an antibody that covers a virus, for example, called opsonization, and it will make it too big to be able to enter into a cell, to be able to attach to the receptor so that it can't be taken into the cell to infect the cell, or you're tagging it to be identified for destruction by certain types of cells. That's all an antibody does. Now, you do have certain types and different types of antibodies in your body. And it's important, if you know the type of antibody, you'll know the type of immune system response. Now, this actually goes over the four from WebMD, goes over the 4 types of antibodies. Actually, you have another type of antibody, which is known as IgD. Here's what's interesting. They really don't even know what it does. Doesn't mean that it's not important, because just because medicine doesn't know the purpose of it doesn't make it any less important. Kind of like your gallbladder and kind of like your appendix. We don't know what it's actually for, so I guess it's not that important. There's a purpose behind every organ inside of your body. So what are the functions of these different antibodies? You have immunoglobulin A, are also known as secretory IgA. These are found in the mucous membranes of the lungs, the sinuses, the stomach, and also the intestines. Basically, what secretory IgA is 10 to 15% of your total antibodies. These act, especially in your gastrointestinal barriers, as the bouncers. They're there to keep things out. Okay. And if you can test on a stool test secretory IgA. And if you see that the body has put a lot of antibodies at the gastrointestinal barrier, it means that the body thinks that it's under attack, which means if you have someone with a permeable gastrointestinal system, you'll see a lot of secretory IgA there. You also have immunoglobulin G or IgG. This is the most common antibody that your body makes. These antibodies protect you against infection by remembering which germs you've been exposed to before. This is 70 to 75% of your total or total antibodies in your body right now. Okay. So, and it's very, very important. If you guys have ever had things like Epstein-Barr virus, and you can actually measure versus if you've had recent exposure or if you have had a longer an exposure of 3 or 6 months ago by this type of antibody production. So that's why we've measured people and we've done blood tests and say, hey, let's look and see, if you have an active Epstein-Barr infection that's associated with mononucleosis, chronic fatigue syndrome. And we see that, they have lower levels of IgM, high levels of IgG, which means, hey, this is an infection that's been long-term and has been ongoing as well. This is also how you can measure certain types of food allergies as well. So then you have IgM, which is actually one of the first ones that are made when you're first infected with bacteria or with other viruses as well. It's our first line of defense against any infections. This will actually show recent exposure. And then you have IgE, immunoglobulin E. Your body makes IgE antibodies when it overreacts. I don't know if it's overreacting because it's primarily IgE is a type of antibody that's used when you have parasites. Okay. So that's why if we do see people who have a high level of IgE food allergies, we also look and see if they do in fact have parasites as well. So your doctor will likely measure IgE levels if you have a blood test to check for allergies. Here's what's interesting, guys, is how many of you have gone and gotten a scratch test on your skin, yet you're having an allergy response. Doctor says, I'll order a scratch test just to shut you up and do all the scratch tests and nothing comes back as positive, but something is still happening in the body. And the reason why, guys, you could still be having a different allergy reaction, it's just a different antibody response, is that immunoglobulin E, the amount of antibodies circulating for this is 1/10,000th the amount of IgG. Isn't that amazing? Yet we ignore any kind of IgE allergy response. So guys, I was talking and alluding a little bit more about the whole idea of leaky gut syndrome, in which you have decreased barrier function at the gastrointestinal system that causes things to be able to pass not through the cell, but around the cell. And really what's supposed to only go around the cell is actually water. And those other ones are supposed to be broken down enough that they can be taken in and go through the cell to be passed from external to internal environment. What can cause leaky gut syndrome? Well, having an excessive amount of dietary proteins. Well, what causes you to have an excessive amount of dietary proteins, not amino acid? Stomach acid. What causes low stomach acid? Number one cause is stress. So, which leads into low hydrochloric acid, low enzymes. That can also be low pancreatic enzyme function. Antibiotics will also cause damage to the gastrointestinal barrier. Having infections. So things like food poisoning, E. coli, will damage the gastrointestinal barrier. You guys ever wondered this? Two people eat the same meal. One gets food poisoning. One gets E. coli. The other one doesn't. My question is why did they eat the same thing, yet one got food poisoning, the other one didn't? The difference between those two people was one was able to make sufficient stomach acid to kill off the infection, and the other one wasn't able to. Blood sugar issues can cause this as well. Another antibiotics, pregnancy. We'll see some changes take place with pregnancy, menopause, although it's not necessarily menopause per se. A lot of women feel bad from menopause and has nothing to do with menopause as much as to do with your hormones were covering it up and you saw a drop of hormones and all of these issues, inflammatory issues, get exposed. Toxins will do it as well. Food allergies and yes, stress. And some of these are a little bit redundant. Biggest thing with leaky gut syndrome is low stomach acid, high amount of stress, antibiotics, certain medications that you can take. Having an infection can also do it as well. and then the inability to be able to break down those proteins. And so what happens is they start to go through, the immune system starts to react to the barrier continues to get destroyed more and more and more, which is then why everything that I eat can eventually cause a either an IgE or an IgG delayed reaction, in which you're getting a lot of issues with things like bloating, brain fog, joint pain. Yes, that's why we always test people when they have autoimmunity. And yes, you ever wonder why people can eat and eat and eat and eat and they still suffer from malnourishment or they can't gain weight? Look at this, because this can be the reason why. So let's talk about a couple other causes, okay? Notice how I circled what are known as T regulator cells in the couple of slides before. So here's the role of vitamin D, even when it comes to food allergy and autoimmunity. This comes from PubMed, and the title of it is Vitamin D Supplementation and Regulatory T Cells in Apparently Healthy Subjects, Vitamin D Treatment for Autoimmune Diseases. Here's what they say. Epidemiological data show significant associations of vitamin D deficiency and autoimmune diseases. Vitamin D may prevent autoimmunity by stimulating naturally occurring regulatory T cells. Guys, it's the T regulatory cells that are also involved in allergy. Guys, have you ever noticed when someone has a lot of allergies, they tend to also have a lot of autoimmunity as well? And because it has to do with how their immune system is responding. Their conclusions, vitamin D supplementation was associated with significantly increased T regulator cells in apparently healthy individuals. So this is why people say, I take my vitamin D. What's the role of it? The role is your immune system. This is why if you do have allergies and if you do have autoimmunity, gosh, you should be getting your vitamin D levels checked. And I always laugh at like some doctors who say, yeah, vitamin D, not that important. It's just involved in calcium and things like that. No, vitamin D is involved in 1,500 genetic functions. And just to just pin vitamin D to calcium is doing it a huge, huge, huge disservice. Here's another one too, guys. Does early life exposure to antibiotics increase the risk of eczema, which is another allergy type response that's going on, except now that you're seeing it at the skin. So here's what they say. We examined 20 studies and looked at the association between prenatal or postnatal exposure to antibiotics and the development of eczema. Here's what they found. There was a significant dose-dependent association suggesting a 7% increase in the risk of eczema for each additional antibiotic course received during the first year of life. Let me ask you a question. How many antibiotics has your child in the first year of life been exposed to? Because every single time they're exposed to a new round of antibiotics, the incidence of eczema goes up by 7%. We conclude that exposure to antibiotics in the first year of life, but not prenatally, is more common in children with eczema. So you may say, well, my child had 3 rounds of antibiotics. They don't have any kind of eczema. Guys, because everything is multifactorial. This is why when you talk about nutrition, for example, they're say, see, we gave a person a high dose of fish oil. We gave a person a high dose of vitamin C, and it didn't improve every single person with this because maybe there was a different reason why. Maybe is that when you look at the whole idea between sickness, is that maybe it's not one thing, maybe it's multiple things filling up the bucket. And how you get a person well is understand that everything can cause everything, and look at it from a Swiss watch principle, and then say, in order to get you well, we're going to clean all of these things out and empty the bucket so the body can start to heal and the body can start to recover. Here's another one. Stress hormones, Th1, Th2 patterns, anti-inflammatory cytokines, and susceptibility to disease. Here's what's really interesting about this, okay? Because if you look at the Th1, you look at the Th2, and this has to do with how the body regulates immune system responses. Someone's high in Th2, they're going to have a lot of allergies, things like that. And if they're low in Th1, they're going to have problems with hyperinflammation taking place. And you want to balance between Th1 and Th2. So people high in Th2 tend to have a lot of autoimmunity, allergies, and things like that. So what they said is that stress hormones actually suppress Th1, which made you actually more susceptible to things like cancer, things like viruses, and it increased your pattern of Th2, which then gave you more allergies and autoimmunity and things like that. So let me say that again. Stress causes damage to your immune system. Here's what they say in this. This is 24 years ago. In general, stress has been regarded as an immunosuppressive Recent evidence, however, indicates that acute, subacute, and chronic stress might suppress cell immunity, but boost humoral immunity. So this is mediated by differential effects of stress hormones, glucocorticoids, and the catecholamines. Okay. Um, so this has to do with how certain stress hormones are made, things like adrenaline and cortisol, things like that. Here's what they say. Acute stress might induce pro-inflammatory activities in certain tissues through neural activation of the peripheral corticotropin-releasing hormone, mast cell histamine axis. Interesting. How many people, if you have MCAS, how many people, when you get stressed out, you see an immune reaction take place, or you see that the symptoms of it get worse? So here's what they say. Through the above mechanisms, stress might influence onset or course of infectious, autoimmune, inflammatory, allergic, and neoplastic diseases. Isn't that interesting? So any doctor who is not addressing your stress is doing you a massive, 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 let me say that again, a massive disservice. That's why when we say we take care of the whole person, because the reason why a person gets sick is because of mental, because of chemical, and also structural. Those three things and how they play in with your hormones, they play in with your immune system, they play in with your digestion, they all play together. Impact of vitamin D deficiency on increased blood eosinophil counts. This comes from a few years ago, about 5 years ago. Vitamin D has been increasingly recognized as an immunomodulatory agent. Its deficiency has been associated with immune-mediated diseases such as asthma, rhinitis, atopic dermatitis. We investigated the association between serum vitamin D levels and blood absolute eosinophil count. Here's what their conclusion. Vitamin D deficiency was associated with a higher blood eosinophil count. These results support the possible role of vitamin D in the eosinophilic immune system response. Interesting, huh? Because now they're even talking about stress. Now they're talking about vitamin D. I want to give you some blood work that we did on an individual. Here's someone who came in and was having problems sleeping, having problems with anxiety, was having problems with allergies. And we tested, and you can see that there are some issues when it comes to liver, sugar metabolism. So obviously looking at that, we did a lot more testing than this. But here was so interesting is vitamin D levels were at 16. Okay. They were at 16. So very, very low. And I said, well, the first thing we have to do besides, 7 other things, get your vitamin D levels up, because this is associated with an allergy response. And not just 5,000, we started him off on about 25,000 IUs per day for the next 4 weeks. Interesting, huh? Now, vitamin D, it's important to take it. It's also important to get out in the sun, because how many times have they said the sun is bad, the sun is evil, you must put all kinds of sunblock on your child. They need to be white as a ghost, or if they happen to be Caucasian, and the child never gets any sunlight exposure. And as a result, maybe that's one of the reasons why, if your child has very low vitamin D levels, why they do in fact have a allergy response, because of an increase in eosinophils and a lack of balance between Th1 and Th2. So allergies, what do we know? Again, guys, we're just talking about physiology. That's it. What do we know? What do the experts actually say, but really do a very poor job as far as teaching patients how to do this correctly? Number one, the introduction of solid food too early. So when should a baby get introduced solid food? I would say wait a minimum of 9 months until the gastrointestinal system can actually close up. And remember, babies do not make secretory IgA. In fact, they don't make antibodies in the first 3 months of their life. Makes you wonder when you go 3 to 4 months, I would say, makes you wonder when you go to the pediatrician, or even before you leave the hospital and they're doing certain things like hepatitis B, or if you're doing some 3-month well-check visits, they don't even have the ability to be able to make an antibody response to it. So introduction of solid food too early, that's causing leakage of the food proteins through the gastrointestinal barrier, lack of breastfeeding in order to supply secretory IgA, How about this? Stimulation by bypassing the barriers. So when we actually are introducing, yes, I'll say it, vaccines. So when we introduce an antigen by bypassing the barrier, you do not have a normal immune system response. Antibiotics will do it. Being too sterile, like avoiding germs all the time. We saw this over the last 3 years. Poor stomach acid production. How about stress? Because stress causes immunosuppression in one aspect and can also cause immune system activation of certain parts of the immune system. And also, the number one reason why people do have poor digestion is because of stress and how it affects stomach acid production. And then also insufficiency of nutrients. One of them actually being low in vitamin D. How many of you actually supplement with vitamin D if you live, the further north? How many people do in fact supplement with vitamin D when they're not getting any kind of sun exposure? I will say this: if you are darker skin and you live further away from the equator, is that this can actually cause more issues with vitamin D, because you can tolerate a lot more sunlight in order to stimulate vitamin D production. So your skin is darker, which means it's harder in order to stimulate vitamin D production, because you're supposed to be able to, according to your heritage, actually have exposure year round. But then you move up to Chicago or up to Minneapolis and you go 6 months with the inability to have any kind of sun exposure. You absolutely should be supplementing with vitamin D. And not only that, you also should be absorbing it as well. And I know that I've done some things on, hey, I'm taking vitamin D, it's not going up. Why is that? And I go over a couple of reasons as far as why that is. So the solution, guys, what is the solution? Just like I said, just recently, you have to address the mental, you have to address the chemical, you have to address the physical. You address the whole person. You don't just address one thing, because the body works like a Swiss watch. And this is why I always say is that when you continue to just keep going down the line and going from specialist to subspecialist to subspecialist, they only look at one thing, but they're not actually treating the whole person. That's why I say is a specialist is someone who knows more and more about less and less until finally they become an expert in nothing. So that's why you have to take care of the whole entire person. Because I want you to think of this. Let's say that you are having a problem on your skin. You're going to go to a dermatologist. They're going to give you something in order to suppress the immune response on the skin. You'll see that possibly clear up. And they say, see, we took care of it. But they're not going to go with the fact that maybe it's coming from the gastrointestinal system. Maybe it's coming from stress. Maybe it's coming from 19 other different things. They're just looking at where you are having the symptoms, but it can be upstream at multiple different places as well. So you have to address the physical, you have to address the chemical, and then you also have to address the mental too. So what do? Physical, get an x-ray. You get an x-ray. You get an x-ray and you actually look structurally to see exactly what is going on, because this can play a huge role in the stress response that's taking place. Chemical. Get an IgE food allergy test. Many times someone is having issues with these types of things. We do an IgG food allergy test. We do a stool test, check their vitamin D. We even do a CBC with a differential, because the type of immune system response that you are having, your CBC will actually give you clues. It will give you clues. So what is your differential? Neutrophils, lymphocytes, monocytes, eosinophils, basophils. You see that some are more elevated than others. It'll give you a clue to say, here's what's happening. Here's what your body is trying to fight off inside of the body. And then also mental. Okay. Mental is huge, guys. It is so important, which is why almost everyone in our office leaves with something in order to decrease mental stress. Guys, one of the best things that I do, I even take it, is called California poppy. There's California poppy, there's kava, CBD, even ashwagandha used in combination can help when it comes to mental stress. But if you do not handle the mental stress, ladies, I will tell you, it is very hard for you to get better. It really is, because of how mental stress not only plays a role in digestion, in the immune system, but how it plays a role in your hormones as well. So think of this. Please don't go ask your doctor for these tests. Okay. They just don't do these tests. Work with the Wellness Way doctor. If you're like, Doc, how do I work with the Wellness Way? Well, just go to www.thewellnessway.com and then just type in your address and see if you can work with a Wellness Way doctor that's near you. There's about 60 different locations across the United States, and see if you can work with the Wellness Way doctor. If you can't find one that is close to you, reach out to corporate Wellness Way, and they may be able to pair you with a doctor who has availability to be able to pair you with a doctor who can order the test for you, drop ship the test for you, and then be able to order the right test and then be able to go over them with you as well. Please don't go to your MD and say, Doc, I want to do these tests, because they'll look at you like you have a third eye. Why? Because they're just not trained in looking at it from this perspective. So if your doctor says these tests are unnecessary, and in fact, I'll tell people, I want to go to my doctor and order these tests. I'm like, okay, they'll say they're unnecessary and you'll waste 2 weeks. Just get them now. And that way I don't have to tell you that I told you so. But when they say they're unnecessary, all it means is this: they don't understand a different perspective. And remember, if you're watching this, is because the perspective that you used hasn't worked, that you've come to the conclusion, maybe there is something different. Maybe there is something better that's out there. Maybe there's something that we can start doing in order to get to the cause. Maybe the body isn't just messing up. Maybe it's smart. Maybe it's trying to do everything it can to adapt with what I am doing to it. So let's start getting to causes versus just putting out fires over and over and over again. And the reason why it hasn't been working is yeah, we do a great job of keeping people alive, but we have a lot of people who just continually stay sick and they live their lives chronically ill. But there's a difference between being alive and truly living. There's a big difference between the two. We want you not to just be existing. We want you to be alive. We want you to thrive. We want you to have an incredible, awesome life. So if your doctor says these tests are unnecessary, it just means that they don't understand a different perspective. So guys, thank you for joining us. Next week, same time, we're going to go over allergies part 3. We're going to talk about natural remedies while you heal. That's why I say while you heal, because there are certain things that you can do in order to help you to be able to tolerate certain things while the immune system actually starts to heal as well. Okay. So guys, again, make sure that you share this video. You can also share it on Rumble. You can share the link from YouTube with your friends, with your family. Hey, and if you don't like us as well, if you don't follow us, I would always be humbled and honored if you would do that as well. We do our best to try to bring out as much awesome content as possible. And so give us a like, give us a follow, and also make sure that you share this video. So guys, be well, be blessed. Remember who you are. I hope you guys have a great rest of your day and a great rest of your week. I may be joining or popping on later on in the week. And if I do, I'll let you guys know. Guys, be well, be blessed. Remember who you are.